Good evening, everyone. This World's Day is celebrated on 1st December. So, in this World's Day, let's take a pledge to ensure stigma-free environment for people infected with and affected by HIV and AIDS. So, end inequalities, AIDS pandemics. In this scenario, we are seeing that there are different people having AIDS or HIV positive. So we neglect the patients. But in this 2022, the theme of the AIDS patient is equalize. This year, the theme encompasses on eliminating the inadequacies such as gender inequality that have slowed that high against the disease. So, in this day, the world is celebrating the inequality of the AIDS or HIV patient. So, first of all, we are going to what are HIV and AIDS? HIV. And human immunodeficiency virus is a virus that attacks the immune system and destroys the CD4 cells, that is the white blood cells, without strong immune system. The body has trouble fighting off the disease. So that means it can weaken the immunity system. Now, coming to the AIDS. The AIDS is the last stage of HIV infection where you can say the AIDS, the people with HIV positive, when all the immune system is disrupted, people with AIDS have a low number of CD4 cells, white blood cells, and getting infection of cancers or tuberculosis that rarely occur in healthy people. This can be very deadly. No, so how HIV is spread? So this virus is very deadly disease that is contaminated with the body fluids like blood, like sperm, like semen, like any fluid or any sebum, mucus through the blood. So this only can get HIV direct contact with certain body fluid from person with HIV. These fluids are blood, semen, preseminal fluid, rectal fluids, vaginal fluids, and breast milk also, and from the bloods also. So if you have done sex without condom with a person which HIV positive, you can have HIV. Mother to her baby. If any HIV positive woman is carrying pregnancy, then the blood or body fluids will be transmitted to the newborn baby also. So if any person is connected with the HIV positive blood and the blood is transfused to that patient, then the patient can be get HIV positive. And sharing needles, if the positive patients having some blood donation or any type of kind of test like this and syringe is used, where the syringe is not discarded after blood drawing of some patients, he may be HIV positive or may not be HIV positive. So that sharing needles without any disinfection may cause the HIV. So, how to prevent HIV? Or there is some misconfusion. HIV is not spreaded by the air or water. मतलब कि if you drink some water with him, it is not spreaded. Mosquito or other insects, saliva, tears, sweat, that is not mixed with the blood. Okay, shaking hands, hanging or kissing, or sharing towels. But kissing will be some type of risky. Other sexual activities that don't involve exchange of body fluids. Okay, now how to prevent HIV? If you have HIV, use condoms correctly every time you have sex. You have inject drugs, use only the sterile injection equipment and water, and never share your equipment with others. If you do not have HIV, then but you are at risk, talk to your healthcare provider about pre-exposure prophylaxis, pre-EP, to reduce the risk of getting HIV through sex or induction of any drug use. So using condom, get tested whenever any blood is transfused, any blood is donated, then take the blood tested, then pre-EP, that is the pre-enclosure prophylaxis should be taken, and get on treatment. If HIV is positive, then you have to get on treatment with the antiretroviral drugs. So how the treatment or prevention can be done? So there are different antiretroviral therapy. Oh, now coming to the HIV symptoms. HIV muscle aches, chills, mouth ulcer, fever, sore throat, fatigue, night sweats, swallowing lymph nodes, skin rashes. These are the very important skin infection and different infection. and because infections are going on and immune system is disrupting, no, that's why. Now, reduce your HIV by using condom, ensuring that your partners are well living with HIV are taking treatment, using PEP to prevent getting HIV if you have ongoing risks and including during pregnancy, and using sterile needles, getting tested and treated for sexually transmitted infection. So now there are some drugs I'm discussing about this prevention of AIDS. HIV negative individual prevention, how can we do? These are the normal infection, normal type of, like be cautious about blood products, get regular screening test, consider male circumstances, and using new latex or polyurethane condom every time you have sex. Know the HIV status of any sexual partner, like this. Educate yourself. Now, if someone is HIV positive, now he can go for the antiretroviral therapy of the drug, anti-HIV drugs. So, virus having the RNA with him. So, if the RNA cannot be replicated, then the prevention will be done. Anti-HIV drugs can be classified into nucleoside reverse transcriptase inhibitor, non-nucleoside reverse transcriptase inhibitor, and nucleotide reverse transcriptase inhibitor, protease inhibitor, and entry or fusion inhibitor. That means, so there are some nucleotide and nucleoside present in the RNA. So the nucleoside reverse transcriptase inhibitors means that drug will be acting on the nucleoside reverse transcriptase. So as a result, that enzyme will not produce any nucleoside. As a result, RNA will not be produced. That is known as the NRIT. So zidovudine, stabudine, lamivudine, abacavir, jalcetabine, these are the important drug. Amitrocitabine, didanosine. Next coming the non-nucleoside reverse transcriptase inhibitor, NNRTIs, efavirenz, nefavirenz, delavirdine, these are the nucleotide reverse transcriptase inhibitor. Coming to that, another tenofovir, that is the another type of. Now protease inhibitor, that will prevent the synthesis of proteins. Sequinavir, indanavir, nelfilavir, amprinavir, this is the important drug. Entry or fusion inhibitors, enfulovredit. Now there are next another category of drugs I'm saying. New combination of the approvals like bictegravir, emtricitabine, tenofovir. So these drugs are acting in the NRI, acting like NRTI, nucleoside reverse transcript inhibitor. So indications how it is used: treatment of HIV-1 infection as a complete regimen. 1 tablet by mouth daily, oral, and approval 2018, that is not required. Now there are another different drugs, lamivudine and tenofovir, disproxil fumarate, 1 tablet by mouth daily, we have to take it. Next, there are the different type of drugs some of the persons have to take it. Okay, now coming to some nucleoside reverse transcriptase inhibitor, that is important. First, agents available for HIV infection, less potent than NNRTs, have a central role in IRT, have activity against HIV and HIV2, nucleoside and nucleotide and analogous, differ from normal substrate only by a minor modification in sugar. Abacavir, didanosine, emtricitabine, lamivudine, stabudine, tenofovir, zidovudine, azithromycin, like this. Types of antiretroviral drugs. Nucleoside reverse transcriptase inhibitor, NRIT, non-nucleoside reverse transcript inhibitor, NNRIT, nucleotide reverse transcript inhibitor, nucleotide analogs, protease inhibitor. So 5 type of antiretroviral drugs are used: inhibit enzyme and required for HIV, that is the reverse transcript inhibitor, integrase inhibitor, and protease inhibitor, and block viral entry into the cells also, that is the fusion inhibitor and CCR5 antagonists. These are the internal drugs. So let's stop HIV together, get prevented, be secure. So 3 things to know about HIV treatment: HIV medicine cannot cure HIV, but they help people with HIV live longer lives. People with HIV take a combo of medicine daily. This medicine help to prevent HIV from advancing to AIDS. HIV medicines reduce the risks of HIV transmission. Thank you. Thank you all.